Why does America spend more money on healthcare than any country in the world, but still have some of the worst outcomes? Higher costs, shorter lives, and a system that's failing us. It's like paying for a Ferrari and getting a rusty bicycle. We've convinced ourselves that the system we have is the best way, the only way. But here's the truth. It's not just broken. It's wasteful. We're already paying enough to justify universal health care. Actually, we might even save money. First, the numbers. In 2023, the U.S. spent nearly $4.5 trillion on health care. That's more than any other country. Yet somehow our life expectancy is lower, infant mortality is higher, and chronic diseases are more common. What's even more absurd is how insurance companies profit by denying care. Before Obamacare, I was not able to buy any health insurance. For 8 years, they denied me for things like being underweight or having breast implants. They'll find any excuse not to pay, all while raking in billions in profit. It's not about your health, it's about their bottom line. What's wild is that most of the $4.5 trillion isn't even spent on your care. It's going to administrative costs, inflated drug prices, and endless paperwork. Administrative costs alone eat up 8% of our healthcare spending, compared to just 1% in countries with universal systems. You don't need a degree in economics to see the inefficiency. And here's the kicker. We're already paying for people who can't pay their bills. When someone can't cover a $3 million hospital tab, that cost doesn't just disappear. It's built into our premiums, taxes, and hospital fees. We're paying for it anyway, just in the most chaotic, wasteful way possible. And I know what you're thinking, but universal health care means the government will drain our wallets, right? As a single mom, I'm already paying over $800 a month for health insurance for my son and me. That's $10,000 a year. And I still have copays and deductibles. Imagine saving that money instead. And no, universal health care doesn't mean banning private insurance. Most countries with universal systems still allow private options. Your doctor can still choose which insurances to accept, just like they do now. The difference? Everyone's covered for the basics and no one goes bankrupt over a broken leg. Universal healthcare isn't about creating a perfect system. It's about creating a system that works. In Canada, healthcare costs are about half of what we pay, and they live longer. Why? Because they don't waste billions on billing departments or advertising for insurance companies. So the next time someone says universal healthcare costs too much, ask them this. How much are we already paying for a system that leaves people out? For a system that forces families into bankruptcy and makes us choose between health insurance and basic necessities? The real question isn't, can we afford universal healthcare? It's, how can we afford not to? Let's stop pretending this is about saving money. The real waste is happening now, and we're the ones paying the price.